Are RNA-based therapies the solution to unanswered calls for treatment for 1q21 abnormalities in multiple myeloma? Hello, my name is Haley Hodis. I'm a junior at Pinecrest School in Fort Lauderdale, Florida, and this project seeks to identify microRNA targets for treatment of multiple myeloma with 1q21 amplification. Multiple myeloma is a hematological malignancy of plasma cell origin that affects the bone marrow. So essentially, abnormal plasma cells seen here, or myeloma cells, make abnormal antibodies, and therefore patients cannot respond well to infections. Although there are treatments for multiple myeloma, including chemotherapies and autologous stem cell transplants, these often lead to patient relapse within 3 years. Multiple myeloma occurs due to various cytogenetic abnormalities that happen throughout the disease. Published research frequently identifies the amplification of chromosome 1q21 as a negative prognostic factor with no available treatments. This is also seen here in the image. What can we do to control these abnormalities? MicroRNAs may be the answer. MicroRNAs are a family of non-coding RNAs around 22 nucleotides in length responsible for regulating gene expression, and they typically do this by bringing gene expression down. Because they're naturally occurring in the body, therapies that work to restore normal microRNA homeostasis represent a promising therapeutic avenue in cancer. In summary, for this project, genes were first identified as mapped to 1q21 in multiple myeloma. Then, once these two lists were identified, they were cross-matched to identify 254 genes on 1q21 and affected in multiple myeloma and further validated in gene enrichment analysis. Then, downregulated microRNAs in an aggressive group of patients were identified from a previously published study. MIRDB was used to predict the targets of these microRNAs, identifying 1,161 genes. These genes were cross-matched once again to the 254 to identify 5 putative gene targets and their corresponding microRNAs. These targets are essential for the future of microRNA therapy development for 1q21 abnormalities. This project identified various gene targets that are all extremely related to multiple myeloma. This is the first project identifying microRNA targets that target 1q21 abnormalities, and future work would include using more patients to identify more downregulated microRNAs and testing this in vitro or in vivo. This would include synthesizing the downregulated microRNAs into lipid nanoparticles. Current treatments for multiple myeloma cause patient relapse, and treatments such as CAR T-cell therapies, although promising, permanently alter the genome and present major side effects at a price of $1 million per patient. RNA-based drugs are a novel treatment that are more affordable, easier to make, and can be used against all cancers. I would like to thank my mentor, Dr. Sophia Adamia, for all of her extended support, as well as Ms. Jennifer Gordon-Neer at the Pinecrest Science Research Program for all of her help. Thank you.